here at Baden-Baden, Germany, at the Congress for Biological Medicine. I started my journey in biological medicine in my internship, actually, because I rotated in a hospital that had a ward for alternative medicine. So I used to go up there and see what was happening, and I saw that many patients who were on biological medicine were doing much better than those patients that were not. They were being treated just conventionally. So throughout the years, I've dwelled in that. Then shortly thereafter, my dad was diagnosed with stage 3, 4 prostate cancer. He was an MD Anderson. I took him out of MD Anderson, and he lived to be past 80 years of age. So that was my early beginnings in biological medicine. And of course, we know that in medical school and in our training, there's no emphasis on biological medicine. It's always management. It's not really helping the person with the core features, the characteristics of disease itself. It's just like a Band-Aid approach. So it was very important to me as I grew in this field of wanting to help patients in a holistic setting to look at biological medicine as the point to be, because it says it right, biological. It's biology, and it's logical if we want to play on words, but it's really the true essence of working with the patient, especially in cancer, from the truly holistic approach, mind, body, and spirit. So in biological medicine, we have to get to the deep tissue, even at the cell level, and what's called the ground regulating substance, or extracellular matrix, which is that space between the cells, and this is where nutrient uptake happens, cell to cell. This is where cells dump their waste. This is where the electromagnetic potential of cells occurs. So this space, the interstitial space, is quite important. And through EAV, electrodermal screening type devices, we can see what's happening in this very important ground regulating substance. And besides those, there's a host of other therapeutic ways to treat once you assess. Other modes of assessment, for example, are using homeopathic nosode test kits, they're called, for allergies and others that can give us that information. At Hope4Cancer Institute, it is clear to us that the mind-body connection is of utmost importance. Even if we look back to the ancient Greeks and Egyptian time, when someone went to a health facility, independent of what the disease process was, the first person they saw was a spiritual advisor, the monk, the rabbi, the priest, the minister. The second person they saw was the psychological advisor, to look at the mind and how that affects what's happening in the body. And the body was the last thing that was addressed by the medical doctor. So we were kind of in the corner by the bathroom and, the least important. And nowadays in conventional medicine, this is flip-flop, and there's no attention to the mind, usually, and for sure no attention to the spiritual person. So one of my famous quotes, and I'm glad to say this once again, it's a negative thought can kill you faster than a bad germ. And this was in the time when, for example, antibiotics didn't exist. They knew back then that what's in the mind, these traumas, these conflicts are so important. And a thought is a thing. A thought has energy. A thought has information. A thought has electromagnetic fields. So when this is negative, when there's fear, anger, resentment, all these emotions and these traumas and fear, they affect us on a physical level and also on a psychological level. There's an important point that I'd like to mention. There's something called an assemblage point. Assemblage point is where all the energy in our body meets, and typically it's in the breastbone area, the sternum, right by the xiphoid process. It could be also, sometimes people call it by the heart chakra. So the assemblage point is an area of high energy where we can really balance ourselves emotionally and spiritually. So then the physical part of our body cannot exist in a disease state. So for sure, addressing the emotional, spiritual, having that mind-body connection is something that we take a lot of effort and time in biological medicine, and for sure at Hope4Cancer. Well, my passion is about living the future of medicine now. And what do I mean by that? The future of medicine, see, sound, exactly, it happened at the right time, because the future of medicine is energy. And sound energy, as you just heard, kind of makes us move, right?
Yes.
And it resonates really well. So sound energy and light energy is so important for health and healing, because without light, we cannot exist. And when there is light, darkness is overcome. See, so I believe that the future and the now of medicine is energy medicine, specifically with light, sound, and other energetic modalities. What happens is the light and sound activates a substance that was uptaken by cancer cells, and then it causes a release of oxygen radicals, O minus, and that's toxic to cancer cells. So now we could deliver sound externally, and because our body is about 75% water, as you know, sound travels very well in water. So we could get to deep tissues, we could get to bone, to deep organs using sound therapy. Light has a depth of penetration limitation, right? So if you're
Right.
behind a wall and you shine a flashlight, you can't see it on the other side, but if you talk, you could hear the sound on the other side of the wall. But now at Hope4Cancer, we've developed ways, together with one of our German colleagues, where we can deliver intravenous light through an IV, totally, it's invasive, but it's totally safe. There's no side effects. So now we can get to those cancer stem cells that are circulating in the bloodstream using photodynamic therapy intravenously. Yes.
That's wonderful. Well, I know that light carries information. You could always uh, impregnate that light with certain frequencies and then use that as well. So we're learning more and more about that. I think that was the limitation of just simply photodynamic therapy, was that it didn't penetrate through the body, but when you add the sound to it, it penetrates deeper.
That's right.
And so that's wonderful.
And we could avail ourselves to the different type of light waves. We're using red light, blue light, near infrared light, and shortly we'll start using green light as well. So we're seeing that some of these microbes, parasites, fungus, bacteria, can be killed with this type of photodynamic therapy.